Hi, I'm Rhonda Pick, Managing Editor of Pig Health Today. Joining me is Dr. Paul Sundberg, Executive Director of the Swine Health Information Center. Thanks for joining us.
My pleasure.
So SHIC, also known as the Swine Health Information Center, recently is in its 5-year anniversary. You were founded in 2015.
Yeah.
Give us some highlights as you look back and reflect on the past 5 years. What are some notable things?
Well, the mission of SHIC, to start with, we looked at what we had to do to address emerging diseases, non-regulatory emerging diseases too. The PED outbreak in 2013 taught everybody a lesson about communication and about cooperation and coordination. So the center was formed to monitor for emerging diseases, to look internationally and domestically for things that are happening and coming at us, to do targeted research to help make sure that we're prepared for those things that come. One of the things that happened when we got PED in the outbreak was we heard about it in May, and everybody went, "What's PED and how do we address it?" And we had to do a lot of research real quickly. And one of the efforts that we're trying to do here is to not repeat that, to be better prepared. And the other thing, the last thing that SHIC is trying to get done is analyze data. With the PED outbreak, it was a real opportunity for producers to share information. They really opened up about the health of their herds and what are you doing and what am I doing, and sharing that information and getting together. That communication is one of the things we're trying to take advantage of, because that communication, that sharing of data leads to analysis of the data, and that'll help everybody. So that was the start in 2015. Some of the things that I'm real happy that we were able to get done. In 2015, when we started, the major veterinary diagnostic labs for pigs, Minnesota, Iowa, South Dakota State, and Kansas State, all had different systems for reporting their results. And they all did very well in doing it. There wasn't any problem with the laboratories, but they all had different systems in being able to report those. And that meant that anybody that wanted to get all that data together and look for emerging diseases had to have a programmer sit in the basement in some place with a computer and trying to figure out where everything was from this lab and that lab and how it would work together for just one thing.
Not a coordinated effort.
Not a coordinated effort at all. And so one of the foundational projects that we got done was coordinating all that, putting those laboratories together so now they report and message all of those laboratory results in the same manner. And that can lead then to our analysis of all that data. So if something's going on in Pennsylvania and it comes to Iowa State, and the same thing's happening in Georgia, but it goes to Minnesota, we put that together instead of those being one-off things. It's all put together and we can look for things.
And there's a lot of power in the numbers, because I believe you've said in a previous interview with us that those 4 diagnostic labs represent 96% of the data, so very significant.
Yeah, so that was a good thing. We got that going, and that's led to a lot of progress. The Morrison Swine Health Monitoring Project is another example of cooperation and communication, sharing of data, and the center's been supportive of that right from the start. So that's also, I think, a way to push things forward as we've gone. So really what it amounts to is what we're trying to have happen is that communication and coordination. When we looked at the PED outbreak, Canada looked like they had a much better coordinated response. And we did all we could do as quickly as possible. But the center is really working to try to help coordinate response, make sure we're prepared, and make sure we're ready.
What is the latest update related to your rapid response teams that were formed as part of the program?
Yeah, the rapid response teams were formed. But again, I keep hearkening back to the PED outbreak because that's where we learned a lot of lessons. We did rapid response teams in response to PED because what we had was outbreaks on farms that we didn't understand at all. High biosecurity farms would break with that disease, and we didn't know why. So we formed this rapid response team that went out there to try to help and figure out how it got into there in order to let everybody else know. it worked well. It was a response. It wasn't rapid. We had to fly people across the country. Sometimes it was 2 weeks before we'd get onto the farm. And so that didn't work well as far as the rapid part. What we've done with the rapid response teams and the rapid response corps now is we've signed up veterinarians, epidemiologists, and animal scientists from all over the country in different regions. We've got 6 different regions. And they are offering to, when they get a telephone call, be on a farm within 72 hours after we're invited. So within 3 days, that's the objective. Anywhere in the country, instead of having to fly to them, we can drive.
Boots on the ground.
Right there, right when we need them. So it'll be much more effective.